healthy people equals a healthy society equals a healthy economy. And that's the point that I'd like to stop on now and hand over to Francesca Colombo, please. Francesca, please talk to us about the economic aspects to this.
And it will be a little bit broad, obviously. A lot of thoughts that came to mind following the very good presentation and the introductions that follow myself. The broad point, obviously, that I would like to make is that if we want to be serious about health, about equity, we must put people at the center of policy and of practice. We all agree with that. But in order to do so, we also need to enlarge the scope of our focus. And so looking at the contribution of health more broadly to well-being and to the progress of societies. And I think to do that, we do need to do things differently, at least in 3 or 4 ways. One is to look at the framework for analysis. What is the framework that we use as a society to inform the way we approach interventions, the way we approach work more generally? What's the framework that we use? The second is, how do we measure success in a way? What are the parameters that we use? The third one is, how do we use that to really influence the policies? And the third one is, how do we shape collaboration? So just to make a few words on all of those, but the starting point is clearly, and so I will not dwell much into that. We heard very eloquently from the previous speakers about the impact of the pandemic. So not going to remind some of the striking figures on death and so forth, but one thing that struck me very much in work that we are doing at the moment in looking at how the pandemic is exacerbating social inequalities. We have looked at some recent data that looked how, for example, the likelihoods of dying is at least twice as high between the Black and Hispanic ethnic minorities on the one hand, and the more whiteys on the other hand. And even if we look at differences between people who are least and most deprived, we see differences in the risk of dying of 80%. So really quite striking differences that make us think, how can we address and make a change? And clearly addressing and making a change requires that broadening of perspective. We cannot just simply address that by changing the economic model. We cannot simply address it by even making changes at the margin on the health services that we deliver. And so looking about the framework for analysis, that's my first point of where we want to focus attention. The OECD has done a lot of work over the past decades in trying really to look at the issues of well-being of people and societies, and try to see how, if we want to measure success, we need to go beyond looking at economic systems per se, but really focusing on progress for societies. And society progress is really improvement in the well-being of individuals, of populations, and of households. Obviously, this requires very much addressing the average, how we are able to move ahead on average for populations in different countries, but also looking at the diversity. And by that, obviously, I mean the inequalities of experiences and living conditions of different people. The OECD has developed this framework for well-being that actually puts at the center many different core dimensions. Income and wealth is one, of course, that we cannot do without. But if you look about housing, for example, how much health is influenced by differences in housing, across population groups, knowledge and skills. We know very much that people who have less skills linked to their education are also more likely to have unhealthy working conditions, and that there are two ways, complex relationship between the skills, knowledge on the one hand, and health outcomes. Work-life balance, very important, obviously, for issues related to mental health, social connections and civilian engagement, and so forth. Safety, which has been really particularly important issues in the context of COVID-19, or even environmental quality. And quite clearly, if now we are all grasping with the pandemic, COVID-19, the next big challenge for societies overall will be the environmental changes as well. So if we really want to be serious about people and health, we need to look at a broader framework and seeing and trying to understand the complex interactions between health and different dimensions of people's life and well-being, both in terms of averages and in terms then of the differences across socioeconomic groups and so forth. And it's only in this way that we can maximize the chances of people to really fulfill productive life and improve their well-being. So that's the first point, framework. The second one is about measurement, and obviously being OECD, an organization that care a lot about indicators, data, and so forth. I need to say something about that. So with having a broader framework, we need to look also a different way of measuring success. Clearly there is the issue of moving beyond GDP and improving the statistical measures that we use and how indicators that really are more directly related to different aspects of people's life. I think we have a huge amount of work still to be done to be able to shed better lights on inequalities and better capture how the well-being outcomes of population different across different socioeconomic groups. And also between different ethnic groups and other minorities as well. If we look at even some of the basic statistics, including in the health area, we have a long way to go even to be able to understand what's the situation. So ethnic minorities and other types of minorities, very few countries are able to really even present some of the basic pictures and indicators about those. In health, clearly for measurement, we are pushing ahead with this agenda, which is called the Paris Agenda, which tries to measure more systematically people and patients' outcomes and experiences. The idea is really to try to shift the conversations from a focus on let's deliver additional services to let's deliver improved well-being and outcomes from people. So it's really a way to redefine health systems in terms of accountability and performance for patient-centeredness and not for what health systems are able to do in terms of delivering services. So that's the measurement side. And with that, obviously, there is quite a lot of work that we are doing here in OECD. The third issue is about policies, of course. If we have framework, if we have measurements, it's quite clear that we need to try to address the mix of policies that we use. And here, again, the broadening of perspective is so eloquently put forward and shown by what we are living right now with the pandemic. We obviously need to focus from purely an economic system, and I mentioned that to a broader focus on people and society progress. And so a number of countries are considering how do we put well-being at the center of policies, and how do we try to see what's the interconnection between different policies in terms of how that affects the well-being. I think what COVID has shown to us is that we need to put also much greater focus on resilience of populations, resilience of individuals, particularly the most vulnerable group, resilience and preparedness of the services that we have, and the ability to react and anticipate much more. So we need to think about different policies to be able to address those new, in a way, challenges. We clearly need to focus much more from an attention only to single areas of policy to something that look more at different policies and how different policies complement each other to achieve a given goal. So if you want to address and improve some of the health outcomes of disadvantaged students and pupils, is it better done through the health services, from the education services, or what ways? And can we move away from a focus on single diseases to a focus more on the interactions across different diseases and truly universal health coverage and health system? And then we need obviously to focus on move away from a focus on inputs to a focus more on outcomes. And I mentioned the agenda for measurement that we have. The last point, it's about collaboration. So if we want to do things differently, we need to think about collaborating in different ways with the various actors, with civil society, of course, with people's groups, with also the private sector, with different actors, all of which have an important contribution to make. And why there is a lot of talk, obviously, of having that more collaborative approaches, is more difficult to see on the ground. You know, how can we more successfully improve on the current models? How can we do things differently, even in light of the pandemic? I don't necessarily have here the solutions. I'm sure that you have probably much more even on the ground experience for that, but certainly it's something that as OECD we're thinking very much, how do we make sure that we have that broader perspective in terms of supporting you know, governments through our analysis as well. So I'll stop it there. It's really those things: framework, you know, measurement, policy, and collaborations.
Thank you very much, Francesca. And I think the theme that was running through your presentation was about broadening out and talking to different groups.